Hey everyone, and welcome back to the stream. Today we're going to be answering questions about the medical coding industry. So, exams, schools, study tips, job search, and more. So, grab yourself a drink, say hi to your friends in the chat, and let's get started with today's stream. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. I am here Saturdays, most Saturdays, unless last week I was at Disney, so I wasn't here. But most Saturdays, I am here doing AMA Ask Me Anything, questions about the medical coding industry, especially targeted towards things like students or new coders. So I need help getting study tips for my exam. I need help picking a school. I need help with how to get CEUs. How many CEUs do I need? How do I study certain chapters? Job search, resumes. We cover a lot of great material that you need for medical coding and the medical coding, HIM, medical billing records industry. So let me ask you guys, have you started preparing yet for the 2022 ICD-10-CM changes? So in less than 3 weeks, we're going to be having some updates to ICD-10-CM. I actually did the video for the guidelines that are changing because every year we change our medical codes. We delete a couple, we add a whole bunch in. So I think there was several hundred changes to ICD-10-CM this year, and we revised some, make some tweaks on the text to clarify things a little bit more. So those are going to go into effect for ICD-10-CM on October 1st. Now, I do want to caution some of you because I know this question comes up a lot with the ICD-10-CM changes. So we're going to have some new changes to ICD-10-CM on October 1st, right? The AAPC does not reflect those in their exams until January 1. So January 1 is when the CPC, the CRC, the CPMA, all the AAPC exams change January 1 for the new code sets. So even if you're testing in November, you'll have that new ICD-10-CM book, but you're going to be testing for 2021. So you bring the calendar year that you're sitting for's books. You actually can't bring the next year's books. You have to bring that current calendar year books. So I actually have my CRC bootcamp coming up, which I know a lot of people really love. There's been such great feedback about people who have passed their exam posting on LinkedIn that they love the CRC bootcamp. That's coming up October 2nd and 3rd. 2nd and 3rd of October. So definitely check out contempocoding.com if you're interested in getting your CRC credential and you want to take an accelerated course because you already know MedTerm, you already know some basics of ICD-10-CM, and you want to get that CRC credential. That is a great resource that's available, that boot camp. It's an accelerated training, and I do offer a discount if you use October CRC for the month of, actually for the month of September through the 19th, that coupon code will be good. Really awesome resource. So let's get into some of the questions that have been coming through already. And you know what? My DMs and Instagram have been blowing up, you guys, blowing up with people that need assistance. And a lot of the similar stuff. I'm interested in medical coding, and I can direct some people to resources. Other times, it's a little more intense assistance that they need. And I'm not always able to provide that, but I come here on Saturdays to do the AMA so that everyone has the opportunity to ask some questions. So where are we? I know Amber came in and she was asking a bunch of questions. So I have college classes online. And I was wondering if you have any study tips or strategies for the specific books I'm learning from the Pearson's Comprehensive Medical Coding. So I'm not super familiar with that exact book and that set of books. I am familiar with Pearson in general. I don't think I have those books or have looked at those before. Generally speaking, though, my tips for that are when you have your medical coding books, you're starting out at chapter 1. Read through chapter 1, reread through certain sections if you need to. There's probably going to be some sample cases or studies or little Q&As that you have to do as you're going along. Don't skip those. Go through those. If they have little, questions that you can answer and check your answers in the back, go through those and check those out. Don't skip them. Any additional resources that they provide you, like let's say they tell you to go to the CMS website and look at certain links. Go to that CMS website, look at those links. If you are having specific problems, like it sounds like you, Amber, are having issues because you don't have a live instructor. You have more a self-guided type of program where you're doing self-study through the books. They're giving you maybe Q&A support, no lectures, it sounds like, anything like that. So if you need hands-on more than what you're doing, so if you're going through your chapters, you're studying, you're practicing, the only other things I can recommend is you're going to need more resources, right? So if the resources that you're given are not sufficient to get you to where you are, you're going to need more resources. You're going to need something different. Maybe that's going to explain things to you in a different way. So depending on what type of learner you are, that could mean maybe you just need a different type of textbook. So I recommend the step-by-step coding books. That could be something that you might want to check out. I think I do have them linked in the video description if you want to look there. And they're available on Amazon. They are great. They have a workbook. So maybe you just need some more practice. If you need some more practice, you can just get the step-by-step workbook. Now the workbook only has about half of the answers to the questions in the back of the book, which is a deal breaker for some people, but I think the materials that they have are really great. You could even look for maybe some CPC if that's the certification you're going to go for, some additional study materials geared toward that. Otherwise, if you're someone who needs a little bit more attention individually, I would suggest maybe getting a tutor. You can go to tutors.com. You can go to wisent.com and you can type in medical coding and it will bring up medical coders that are in your area. I actually just saw something. I don't know a ton of coders that do hands-on tutoring anymore, but I know my friend Shannon does because I just saw something pop up on LinkedIn. Shannon Benet. So she does medical coding to private tutors. So you can check her out. She has a Facebook page. She says here, Shannon's Coding Consultations on Facebook. SHANNON Coding Consultations. Shannon's Coding Consultations on Facebook. So you can probably find her that way. She does do private tutoring, and I know she's a very lovely lady, so she might be able to assist some of you that you need tutoring. Otherwise, you can check wisent.com and you can check tutors.com if you need individually. Right now, I'm not taking individual one-on-one tutoring because most of what I'm doing is going out to the masses. It's going out to YouTube, it's going out to TikTok, it's going out to Instagram, so I can hit a ton of people at once that need assistance. So in order for me to provide tutoring, that's going to take a lot of time away from those larger projects that I have to do. And it would not be cost effective for most new coders because of the amount that I would have to charge for taking that time away from the projects that I have to do with the YouTube channel and stuff. Hello, Christina. Good to see you here. Hey, Kirsten. Kirsten, good to see you here. Suggestions on anatomy compliance and billing for the CPC exam. So as far as anatomy, let's see here. The book that I recommend is Medical Terminology and Anatomy for Coding. That one's available on Amazon. As far as billing, I'm not even sure that there's a lot of really billing questions on the CPC exam last I checked, but let me double check because I think most of it is geared towards coding. I don't recall there being billing questions. So let's actually take a look here. If we go to AAPC certification CPC, so let me log myself out real quick here. I don't want to accidentally bring up like my home address or something on here. Okay, let's take a look. So CPC exam, if you go all the way to the bottom, this is how I got here. So if you go to the aapc.com, you go to certification and CPC, this is the page it'll bring you to. And at the very bottom is where it tells you the exam breakdown. So you see this here, exam breakdown. And I apologize, my monitors are like overlapping each other, so I can't always see my scroll bar appropriately right now till I get my new PC moved because it is huge. I had this new PC built by my boyfriend and it is, oh gosh, almost 11 inches wide. So it's taking up a lot of desk space. I'm going to get it moved to the floor, but I want to get a platform for it. So there's actually no specific billing questions on the CPC exam. And actually there's only 5 compliance questions. So if we look here and it says, this is what these 5 compliance questions are, they're going to be compliance and regulations for services covered under Medicare Part A, B, C, and D, applying coding and payment policy, place of service reporting, fraud and abuse, NCCI edits, NCD, LCDs, HIPAAs, ABNs, and RVUs. So I would specify, I have a video on NCCI edits, so that'll help you out there. I'm actually, actually one of the next videos that I'm working on right now is on RVUs. I've had a couple of physicians reach out and say, hey, Victoria, I'm concerned. I don't think I'm getting all my RVUs. I think my coder's coding incorrectly. So I'm going to make a video about RVUs and troubleshooting some of questions that physicians may have on their RVUs. So that's what I would just target. I mean, understand it's only 5 questions. So we're talking a teeny tiny portion of the CPC exam. Same thing with anatomy. It's only 8 questions. Focus mostly on the coding. It's the coding questions that are going to be the bulk of the exam. If you flunk all of your questions on med term or on anatomy, you know, you're still going to be in good shape if you know your coding very well. But yeah, that's my feedback on the anatomy, is to get that medical anatomy and medical terminology and anatomy for medical coding. That's a great book that I have the resource for. And actually, I think I have a couple of videos on the channel about medical terminology. So let's see here. If we go over to the channel page, I don't know if you guys know this. I think everyone has this. I don't think it's just on my page, but if you go to the main channel page, not only does it show you all of the videos, you can search here under this video tab. So if you're looking for a video on a specific subject and you're curious if I have one, you can type it into search, medical terminology. I have a video specifically for MedTerm for Coder. So that would be one that I would suggest kind of checking out, because I list all the really good resources that I know of. Your thoughts on E&M op regarding automation? I actually have a video on that, but my thought is it will definitely make things more efficient. Hopefully, I don't think it will be ever 100% automated. I don't think it will be, I mean, even if you think about things like translation, just because we have things like Google Translate, we still have translators in hospitals and in other organizations, just because everything isn't always 100% programmable. But if you're interested in finding out more about automation and medical coding, I do have a video that talks about AI and medical coding and all of my thoughts on that. Did my comments get stuck here? Hold on a second. There we go. JD is asking, are 2 to 3 months enough for someone that doesn't know anything about coding or medicines to study for the CPC exam? It depends on what your schedule is. I mean, if you're someone who's single, you don't have kids, you don't have a full-time job, you're just graduated from high school, you could reasonably do it in 2 to 3 months. I think most programs are usually at least 6 if you have no exposure, because you have to learn MedTerm, you have to learn about the different parts of Medicare, and then the coding itself. You have to learn, you know, depending on what type of coding you're going into. For like the CPC, you have to know ICD-10-CM, then you have to learn CPT, then you have to learn HCPCS. If you're doing inpatient coding, you have to learn ICD-10-PCS. You have to learn about DRGs. You have to learn probably about the IPPS. So 2 to 3 months, doable. Yes, if you have an open schedule. I think ideally probably 6 months, 9 months. Some people want to go through the full shebang. They want to go for their like an associate's degree, which is awesome, because that'll train you not just on medical coding. It'll make you kind of more well-rounded on things like records and information technology, pharmacology. So if you're looking for like the ultimate well-rounded, this is a long career for me, I want to invest, you know, fully in this, you know, an associate's degree is not a bad idea, but a 6 to 9 month program is usually right, that kind of a sweet spot. Are there practical application operative note dissections on the CPC exam? I find those so difficult. Yeah, they are difficult. They can be really difficult. So with the CPC exam, there are some operative notes that you will have to look through. I think I'm not sure if I have any videos. I do have some videos on operative reports. I think I might have some that do test tips for the CPC exam. So you might have a handful of questions as you're going through your coding sections in the CPC exam on operative reports. So they might be a page or two of operative reports that you have to look at. Oh, Cheryl, I'll get to you in a second, but thank you for that super chat. What I would suggest is look at the answers first because they're going to give you a multiple choice. It's going to be A, B, C, or D. Look at A, B, C, or D and look at what they're asking you for because some of them, they might just want the CPT code. And if you know that you're just trying to pull out those CPT codes, then you don't have to worry as much about the diagnoses, right? Because if you're just looking at that report without any kind of indication of what what you're going to be abstracting from, that you might be trying to pay attention to things and look at things that they might not be asking you about. So look at what they're asking you because they might say, "Hey, what is the CPT code?" Or you never know. You could get to the bottom of the question and they'll ask you, "What's the place of service?" or something. So definitely check at what they're asking you first. Look at those options, then read through that operative report and see if you can pull out things a little bit faster. You can also save them for the end because that one little question they have for you about the blood flow of the heart has the exact same point weight as a 2-page operative report. So if you're looking at something and you're like, "Ooh, this is going to take me a long time to get through," you can always skip that question and come back to it. Cheryl, thank you so much for the super chat. Hello, I was wondering what steps should I take to become a CPCI? That's a great question. I don't have a degree in healthcare, but have several certifications. So the AAPC does have some requirements for becoming a CPC instructor. And they're not super stringent about it. I think sometimes they do flex a little, but if I remember correctly, you need at least 5 years of healthcare experience. So let's actually take a look at the AAPC website because I think they do have something about becoming the CPCI, which is actually now referred to as approved instructor. They used to call it the CPCI, but now since they license out so many other certifications for teaching, the exam itself is called the CPCI if you're taking the CPC track, but you officially become an AAPC approved instructor. So I think they do have something. Let's see where it is. Education. Become a certified instructor. Here we go. Yeah, so you have to be an AAPC member. You have to have at least 5 years of medical coding or healthcare experience. So if you just do billing, you can go for the billing instructor certification and you basically take what they would call the CPBI exam. And if you pass that, then you become an AAPC approved instructor as well. You have to complete an instructor course. If I remember correctly, it's on demand and about $500 for the exam to become an approved instructor, the course materials that you have to pass through. They also have to, in order to become a approved instructor, you have to do a peer review. So you have to do a presentation among, I think it's 5 of your peers. You can do it virtually, you can do it in person, and then they rate you and send in the forms to the AAPC. So that is part of becoming a certified coding instructor. And basically, once you become an approved instructor, it's not like, how do I describe this? So anyone can teach medical coding. I can teach medical coding. You can teach medical coding. Anyone in the chat could teach medical coding. However, what the AAPC does is if you get approved to become an instructor by going through all this protocol that they have, you can license their official curriculum. So with the AAPC, I believe it's $2,500 a year, every single year, to license the material that they have to teach the CPC or the CRC or the CPB. So you have to pay that annual fee in order to license that. Now, as you get more licenses, so I have a CPC, I have the CRC and the CPMA licenses. So as you add on more licenses, it costs a little bit less. You also get CEU applications. So I think I get 25 CEU applications I can do a year to offer CEUs to students and followers and etc. So honestly, considering you can offer CEU courses, it's a pretty good deal. But that's what you do. You go to the AAPC website if you want to become a certified instructor and license the AAPC material. You can go on and apply here, and they'll walk you through the whole process. There's someone dedicated to do that. But again, anyone can teach medical coding. It's just that if you want to teach the AAPC's official curriculum, you have to become an approved instructor. Otherwise, you can teach medical coding, but then you have to develop all of your own curriculum. You have to develop your own tests. You have to develop your own quizzes. You have to figure out how you're getting books to students, materials, PowerPoints, everything. I have a question here. What is the scope for medical coding outside America? I'm Asian. If I complete this course, will I be able to work from home? So, yeah, there are lots of work from home jobs for medical coders. There are also um, opportunities out there to work within a company that might be headquartered in the United States but be in another country. As far as how you locate them, it's hard for me to give some information on that because I've always been within the United States. I've always applied for jobs within the United States, but I know there are opportunities now in other countries, in India, in Iran, in the Philippines, in Asia, that though they can sometimes work remotely. There are considerations that hospitals and healthcare organizations do have on that because in America, we have what's called HIPAA, the Health Information Protection and Portability and Accountability Act. So, there's a lot that has to be considered if we're taking domestic private patient information and allowing access to that outside of the country. If I violate this regulation and I go and give someone's private health information and sell it on the internet, the feds will knock on my door and I go to jail. When we talk about how that applies in other countries, it gets a little hairy. So I know there are opportunities as far as what that looks like. I'm not 100% sure because of always myself being based within the United States. And I know medical coding is going out to other countries. So because of it not just being for billing purposes, but for statistical tracking purposes, medical codes are now being used in new ways that they haven't been in previous years in countries other than the United States. Bree Price is asking, is working as a CPC coder worth the pay? I'm worried that working as a coder won't pay decent enough for a comfortable living. So, it depends on your location, where you're looking to work, how much you invest in it. And there are tools, though, that you can check out. So the AAPC has, let's see here, a salary calculator. So you can find out some information specific maybe for your area. AAPC coding salary calculator. I hope it's working because I know for a little while it was down. Oh, good, it's working right now. So you can get an approximate idea of what salaries might look like in your area. So you can go into Google, type in AAPC salary calculator. And so like here, I live in Pennsylvania. So if I was looking for a full-time job in Pennsylvania and my primary certification, let's see if it has CPCA in here. CPCA. So let's say I'm an apprentice coder. CPCA. Where is our CPCA? There it is, CPCA. So as a newly certified apprentice coder, average salary is $44,845. So, if you're in somewhere that the cost of living is low, that might be a good salary. If you're in San Francisco, where the cost of living is very high, probably not so great. And then you can change it depending on your employer type. So let's say you're working as a consultant. Maybe you're not an apprentice coder anymore. Maybe your primary certification is just the CPC. Okay, so working in a consulting firm, it looks like you'll make more money doing that. So there's a lot of opportunities in medical coding, and that's what I always like to stress upon. So I'm someone who just has my little community college certificate. I took that and busted my butt for years. When there were special projects that no one in my organization wanted to work at, I took them. I didn't care that it was, loading schedules into a new medical record system. I didn't care what it was. I just took them. I got certified. I got extra certifications. I published in Healthcare Business Monthly. I got involved in my local chapters. I started leading the local chapters. I helped run seminars. I helped speak. I started taking speaking engagements, started writing more often, doing regional presentations, doing national presentations, built up to, I think my last job, I made over 70,000 a year as an auditor. And now I don't know if anyone's curious what I make as a YouTuber, but it's quite good for what I do. Ironman is asking, can I recommend a free course? There really aren't a lot of good free courses for medical coding. And the other consideration you have to think about is that in order to become a medical coder, you need the tools of a medical coder. So, like a mechanic or a hairdresser has certain tools that they have to buy. And as a medical coder, you have to buy tools. You have to buy your code books, or you have to buy a software equivalent of those code books. In order to obtain most of the certifications, you need paper books because they want you to test on paper books. So even if you could find a free course, in order to become successful as a medical coder, you need to purchase those books. You need to have those books for your exams. The cost of the exams is several $100s. The cost of membership is a couple $100s. So you should actually probably watch the video that I have on my channel. It's called The Cost of Being a Medical Coder. Because even if you were to find someone who could maybe offer you some sort of free program to learn medical coding, you still need the tools, you still need your membership, you still need those certifications. So check this video out because it is costly to become a medical coder. You do have to invest some money into it. Suzette, I am studying for my CPC exam in October. I did 2 of the practice exams and they were not easy. I am so nervous. Well, you still have some time. It's only September yet. We're only on September 11th, which is why I got my red over here. What I can suggest is go through the rationale of those practice exams that you have. See the ones that maybe you didn't do so well on, really dive into that rationale and understand, was it something maybe you didn't understand in the guidelines? Did you maybe read through the question too quickly? Is there a certain section of medical coding like anesthesia or fractures that you seem to be having specific trouble with? And go over those. My most common recommendation for that is if you take the practice exams and you get about 80%, you're probably good to go on the real exam. That's a good indication that you're going to be ready to pass the CPC exam. Sometimes, you also have to have just exam strategy. So if you get, like I talked about, the 2-page operative report is going to have the same points value as something that's a quickie midterm question. So if you're looking at an operative report and you're like, oh my God, this is not going to be easy, it's going to take me forever to get through this, skip it and come back. You can do that both with the online and in person. So with the online exam, it's broken down into 2 parts. So you'll take one that I believe is around 2 hours and some odd minutes, and another that's 2 hours and some odd minutes. So when you're doing chunk 1, you can skip all around in chunk 1. But then when you move on to chunk 2, you can only skip around in chunk 2. You can't go back to the first part because it's broken down into 2 parts. But you can still skip around. If you're in part 1 of your exam of the 2 for the online, you can go back and forth in your questions. Yes, Suzette. The other suggestion I would have is I do have some videos for studying specifically for the CPC exam. There's actually a playlist on the channel. So if you go to, hold on, let's go back to the main channel. If we go to the main channel here and you go scroll down to playlist, there's a whole one just for CPC exam tips, and that might provide you with some insight on strategies for saving time. Also, I would recommend checking out Hoang Nguyen, HOANGNYGUEN, I want to say, Hoang Nguyen. And he has some great videos too on passing the CPC exam, and they've helped a lot of people out. Do you know how many people we have live currently? 71. 71 people watching the live stream right now. And if you haven't already, don't forget to give this video a big thumbs up and share it with your friends so they can all come in and ask questions. So suggest me which specialization is best, please. So that depends on a couple of different factors. Best as far as which you're most interested in, or best as far as most profitable, because that's 2 different concepts. What's going to make you happy versus what's going to make you money, and maybe making the most money will make you happy. That could be your thing. If you're asking best as far as monetary benefits, what's going to make you the most, interventional radiology and cardiology coding. Definitely check out Stacy Buck, radrx.com. Use code Contempo10 and you can get 10% off some of the training there. But yeah, she is the best for interventional radiology. So the top interventional radiology and cardiology coding and inpatient DRG validation. But those aren't things that you can probably do right out of the gate. You can't go from 0 to radiology coder or 0 from DRG validation. There's something that you kind of have to work your way up to as you grow and develop in your medical coding career. And if you haven't started your medical coding career yet, one thing I can suggest for you is check out onlinedegree.com. So I have a relationship with onlinedegree.com. And they have lots of great offerings for my viewers that are looking to get into a program specifically for medical billing and coding online. They will help you find the program that's right for you. So they developed this quiz. This quiz is exactly the same things I ask my audience, like where are you located? How much do you have to spend? How soon do you want to be done? And they help calculate that all and go, okay, this is probably the good program recommendation for you. And then they offer some discounts and also some potential bonuses, but only if you use my link over here, go.onlinedegree.com/contempo. So if you don't have a program yet, check them out. Other recommendations, check out your local community colleges and business schools, or you can go directly through the AAPC for training as well in medical coding. Absolutely an awesome, awesome option. What else have we got here? Brenda, would the Bucks book and workbook along with your videos be sufficient to be able to pass the CPC exam? I was a paramedic for 13 years and took A&P biology classes, but that was a long time ago. Well, the human body hasn't changed a lot in 13 years though, right? There's not that substantial of changes. So you might be someone that maybe could use maybe a refresher course though. So a lot of my videos that I have aren't really the same as just teaching you medical coding head to toe. So I don't prepare specifically for the CPC exam, like start to finish. One thing that I think would be helpful. So I do have the self-study tools. Bucks, I think, is the best self-study tool there is. The one caveat that I've mentioned a couple of times is only half of the answers are in the book. But considering the quality of the instruction that you get in the book, I don't think you're going to get better quality of instruction book-wise other than Bucks. I think Bucks is fantastic. And watching the videos, I've heard some people say that they've done that. Ideally, I think a course would be good. I would check maybe cco.us. I always recommend they have a couple of different options. They have what they call, they have a full CPC curriculum like the AAPC does and like lots of other instructors do. But I believe they also have a Blitz program, which is kind of in between a little bit. And I feel like maybe AAPC has done something recently where they have different, let's check it out. Let's check out what they got. Because I saw something the other day that was like, are you a beginner or an intermediate or a pro? Let's see where it is. I know I saw something. Let's see. Certification. Register. Maybe it's under here. Education. CPC exam training. Yeah. So look at this. I think this is new on the website where it says here, are you a beginner or are you intermediate or are you advanced? And it has different prep programs. So it says, okay, you can enroll in the full prep program. If you're advanced, it says you might just need study guides, exam reviews. That might be another option too. Like maybe you just want to get the Bucks books and get a study guide and kind of see how you go from there. And if you're a motivated self-learner, there are people who have definitely done that. And not just me, there's lots of other people like Huang Nguyen's out there. And I know there's some other people coming up. I'm trying to think who I can recommend. Oh, AMCI, check out that channel. They do some instructions on medical coding. Who else? Dr. Campbell's CDI Corner. So there's a lot of supplemental videos that you can find. I don't know that there's a lot of like step-by-step. Oh, Codemaster Coach. Can't forget Codemaster Coach. So yeah, there's definitely other channels to check out. Destiny Fate says, hey, Victoria, I'm taking my CPC exam next month. And your CRC course is awesome. Yeah, definitely. A lot of people now are doing CPC and the CRC. I think that's probably the most popular combination right now. Your videos are super helpful to me. Well, thank you, Destiny. I appreciate that. And I appreciate you taking the time to leave a lovely comment. Rico's asking, where's the most prominent place to practice medical coding in 2021 based on need, not money? Are you talking about like where is the the most prominent employer? Trying to think of a lot of prominent employers in medical coding. There's Harmony Healthcare. There's oh gosh. Oh, I have friends that work for it, and it's coming off. It's not coming off of my tip. Yeah, medical coding with Blue is out there too. Jamie King. That's a great point. She's out there as well and has some. I think she does some Q&As that might be more case study type stuff. And oh, it's not coming to me. Sorry. But yeah, I would check out codersdirect.com. So if you're looking for a job, you can find a ton of them on codersdirect.com. So this is a listing that is just jobs specifically in medical coding and medical billing. So if you're someone who's looking for a job, check out codersdirect.com. Hook up with them on LinkedIn because they will just blast your feed every time they have new jobs. So if you're looking for a medical coding job, you can even just post your resume here. So you can post your resume and have employers find you, or you can browse all the jobs. So like if you're a brand new coder, you can go in here. And if you're looking for something remote and you're a CPCA, you can set those filters to remote and to CPCA for an apprentice. And you can search for jobs specifically that are willing to take CPCAs and that are remote. The other thing that I recommend that is helpful is I've talked in the past about like how if you're looking for a job in medical coding, sometimes you can't always right away find a job that the title is medical coder or medical coding specialist, but you want something that you can still use those medical coding skills. What you can do is go into Indeed.com. And when you go into Indeed.com, instead of typing in here coder or coding or medical coder or CPC, what you can do is just type in ICD-10-CM, like type in one of the code sets that you're familiar with. And instead of just bringing up coding jobs, it'll bring up anything that they're looking for that skill set. So a lot of it will be coding jobs, but then it'll be other things as well. So let's see what we got here. Coder, HIM coding tech, coder, medical coder. But basically there you might find some billing jobs in here. You might find some sort of billing coding specialist, inpatient coder. So not just, here we go, billing specialist. So that's not a coder, but they want someone who knows ICD-10-CM. So that's one thing you can do that'll help you find jobs that are not necessarily just medical coding, but they're looking for those skills as well in ICD-10-CM or in CPT. So you can do that to get a more robust filter in Indeed.com. It is hard to get a job as a CPCA, but honestly, I think that's just about every job industry right now. I mean, unless you're a nurse, because they're certainly sure as heck looking for nurses everywhere in the entire world right now. But a lot of industries, when you graduate with any kind of certification or degree or diploma, it's that first job is always the hard to get. And yeah, you just got to keep on going. You got to put in every single day, be putting in applications, get a job tracker, put an Excel spreadsheet together and say, hey, today I applied here, 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 and here, so that you don't wind up repeating applying to those jobs. Make a spreadsheet of yourself, jobs that you applied for, the date, what the job title was. If you have different formats of your resume, because some people do. Maybe some people have one that's more geared toward billing and then one towards coding, or maybe one that's profi coding and one that's risk adjustment coding. Keep track then too which version you're sending. Even things like if you're sending a cover letter or not, because maybe you're getting responses from the people that you're sending cover letters to and not the people that you aren't sending cover letters to. Who knows? If you need your resume done, guys, let me tell you, projectresume.net, that's where you need to go. If you need your resume done, because and this is like crucial for newly certified coders, or if you're switching industries, that's a huge thing too. Projectresume.net, you can go on here. They have all kinds of services that they offer. And the biggest one, of course, is resumes. So you can go on Project Resume and tell them Victoria from Contempo Coding sent you. Definitely tell them that I sent you, but they will do your resume, and they know the things that need to be on your resume to help those employers find you when they have job openings. So projectresume.net, definitely get your resume redone. Sandra is asking, what is AAPC Project Extern about? Will it help me find a job once I get my CPC? It will not help you find a job necessarily. It's a step in the right direction if you haven't done an internship or externship. But what Project Extern does, and we can bring that up and look at it right now, is it will help possibly pair you with an extern site if there is one in your area. I haven't kept up too much if they're recruiting more remote externships. I would hope so, because there's just so much more being done remotely. But you can go on their website, aapc.com, Project Extern. But what it does is it helps pair you with an externship site. Not everywhere has externship sites, but they do have some. There are prerequisites. You have to be an AAPC member with an active credential, and you want to learn and benefit from new ways and coding techniques. So that's one of the two great programs that they have here. So they have the Extern site. You would have to be logged in, of course, and I'm not logged in right now, but you can go in and see if they have Extern sites near you. The other thing that they do is they have a mentorship program. So the mentorship program is for people who are already certified through the AAPC, and you need a mentor. You need someone to help you in your career, not necessarily like, hey, help me code this, or hey, find me a job, but like, I don't know what I should do. Ooh, that's not AAPC. That's the American Academy of Pediatrics. There we go. But they'll help you, navigate your career. Like if you need to talk to your boss about how to get a raise, if you're not sure about what credential you should get next, you're not sure about how to transfer from the billing department to the coding department, and you just need some career guidance, they do have that offering as well. So this is the AAPC mentor program. But again, you have to, in order to be paired with a mentor, you have to be someone who's already a member and is already certified through the AAPC. And if you're someone who's interested in becoming a mentor, you can do that as well. They partner with Mentor City, and that's who the software platform that they use to organize it all. Megan, what would you suggest, AAPC or a HIMA for membership? Ooh, both are awesome choices, both great organizations. Always say AAPC and HIMA, Coke and Pepsi of the medical coding world. So if you're going to go for a medical coding certification, AAPC or HIMA, definitely those top two. Your school's pushing a HIMA. I mean, maybe it's because that's kind of what they're training you for. If you're in a program where you're kind of more in the health information technology, they're going to probably push you towards a HIMA to get your RHIT. A HIMA, I think, it's harder to get CEUs for a HIMA. I think it's easier to find CEUs for the AAPC. The local chapters are more robust. They have more virtual training available. I did a presentation for one of the HIMA, I guess they call them chapters, or they're broken up by state and then I guess locality or something. And it seems like there's a more of a process. They have to have the presentation. It gets pre-recorded. It goes into a portal. With AAPC, you'll get more hands-on live training. So when they have chapter meetings, even virtually, they're live. You can ask questions of the presenter. HIMA doesn't quite seem to have that. But again, you can't go wrong if you're selecting either of them. AAPC and HIMA are both phenomenal. Jacqueline says, I love you and what you do. Thank you so much. I appreciate that. You guys are like so supportive, absolutely amazing and supportive. And I I don't know how I got so lucky to have such an amazing and wonderful community, but you guys are great. And I appreciate that you guys come in here and ask questions and help each other out in the chat too. That's the other thing that I love, that it's not always even just me answering questions, that you'll feed off of each other, and some of you in the chat will help out those others in the questions. And the volume that this channel gets is significant compared to some of the other channels out there. I mean, I see people that are a million times more brilliant than I am and not getting quite the viewership that I am. One of these days, I'll have to figure out what exactly that secret sauce is so I can maybe market it to them as well. Yeah, so Megan, yeah, I mean, really, honestly, you can't go wrong with either. The only caveat I'm going to tell you is it's probably easier to find AAPC CEUs. And if you want to get into inpatient coding, probably go with a HIMA. So if you want to get inpatient coding, probably go with a HIMA. If you're going to do pro fee or risk adjustment, go with AAPC. Let's scroll up. I have a question here from Maylam. What ICD-10-CM book can I bring to the CPC exam? So the AAPC's regulation is a little bit different from a HIMA. So keep that in mind when I'm talking about that. A HIMA has a specific book list that they tell you, like, these are the approved books, and we're going to check the numbers on the back to make sure that they're correct. The AAPC, what I can show you is they have AAPC exam FAQs. So you can bring any edition of ICD-10-CM you want, but it should be the current calendar year. Let's go through here. Exam FAQs. So this is the exam FAQs website. So I can show you exactly what it is that they say on the website. What year's books should I use? And then it also says, okay, where is it? What items do I need to bring? Okay. For a full list of approved and recommended resources, here's the approved resources. I'm actually going to open that in a new tab because I want to show you guys something on that too. But ICD-10-CM guidelines are allowed in all exams, so you can bring your ICD-10-CM book. You can bring a copy of the guidelines separate from that printed, highlighted, underlined, notated, but not writing another book on the flip back blank sides of the pages. You should bring the current calendar year book. You can use previous calendar years. It's not recommended because of all the different code changes, but you should bring current calendar year's books. You can highlight, notate. You can't put loose papers or post-it notes in the book. So that's all covered. If you go into Google and type in AAPC exam FAQs, you'll find this page, and it has lots of helpful information. But one of the things I want to show you, okay, so this is basically the proctor to examinee questions, where it has the listings of approved resources. And some people have trouble reading this. So when it says here CPC exam, okay, certified professional coder, 150 questions, and you're allowed books 1, 2, and 3. Some people misread this and they think, oh, I'm allowed to bring all of these books that are in this entire box. Well, no, you can bring resources 1, resources 2, and resources 3, because that's what it says for the certified professional coder exam, books 1, 2, and 3. So you bring your CPT, and then for ICD-10-CM, it says your choice of ICD-10-CM. You can also bring the printed ICD-10-CM official guidelines. You can highlight, underline, brief notates for day-to-day coding. No long passages of text or information is permitted on the blank pages. And of course, you're also not allowed to, as it kind of says in the FAQs, you're not allowed to write study guide questions. You're not allowed to write practice exam questions or questions from the actual exam. And of course, your choice of HICPEX. So I know someone recently asked me something about, like, oh, can I bring my 95 or 97 guidelines? Or they said that they did. That's exam reference number 4. So exam reference number 4, you can bring for your auditing exam. You can bring it for your documentation exam and a lot of the specialty exams, but it's not one that's allowed for the CPC exam. But yeah, any edition of ICD-10-CM, recommended current calendar year. What is pro fee? Pro fee is professional fee coding. So when we say professional in the context of coding, it doesn't mean like, oh, I'm a professional and I know what I'm doing. It means professional fee, which is provider-based coding. So billing for services that are rendered by surgeons, by internal medicine doctors, by all kinds of different specialists, the services that they're doing, the actual provider seeing you and evaluating you for your chronic conditions, them giving you that flu shot, them giving you, a surgery, providing those sort of services for the provider. What other types of coding we have. So we have professional provider-based fee coding for providers and services and those kind of things. And then we have inpatient coding or facility coding. And that's for patients admitted to the hospital. We're billing for that whole inpatient hospital stay, for them using all of the nurses, for them being in the hospital bed, all the medications, all the care that they had while they're in the hospital. And then we have risk adjustment coding, which is coding based off of all the different risky patient conditions that they have, their congestive heart failure, their HIV, their blood disorders, their heart disorders, amputations, all kinds of stuff that we know costs more. So there's different types of coding, just like there's different kinds of engineering. You can be a mechanical engineer or an electrical engineer. This same thing with coding. There's different types of coding. So pro fee is professional fee or billing for physicians and physician assistants, etc. I apologize if I got a little, I have to block a certain user that keeps popping up on my page here. There we go. All right. Hey, Gemma, good to see you in here. Awesome, awesome, awesome. Horace is asking any tips coding for speed. Yeah, so that can be tough in two ways, right? So for our exam, and then when we get that first coding job and they're going, oh yeah, eventually we want you up to that productivity level. And then you're like, I'm going to make sure that I get there, right? Because, oftentimes you have those, oh gosh, what the heck is going on here? I apologize for these comments coming through. Yeah, I do have a mod. Marissa, where are you right now? Marissa's my mod. But yeah, if anyone else is interested in becoming a moderator, definitely hit me up. I am more than happy to hand over some moderator reins to some of my regulars. As far as coding for speed, so there's two things to consider: your exam and then real life coding, right? So if we're talking about medical coding exams, I do have some tips on that. So if you're going through your exam, everything has the same points value, right? So that question that you're getting that's on MedTerm, that is the same points value as something that is a 2-page operative report. And that 2-page operative report, you want to go through and look at those questions that they have and say, what is it that they're asking me for, so that I know what to dissect out of the question that they're asking. So if they're asking something on CPT, you want to make sure that you're focusing on your CPT coding. If they're asking you what's the diagnoses, then you want to make sure that you're focusing on what are the diagnoses. And if you'll just give me 1 second, I just want to make sure that I quick fix something in my settings. Community, approved users, blocked. Okay. But once you get into medical coding, you have to keep your speed up too. So once you get that first coding job, there we go. Once you get that first coding job, you're going to have probably 90 days or so to get up to speed to where you need to be for your productivity. So as you're kind of building up, you want to make sure that you're learning appropriately from whoever else is in your organization that can possibly help you out. Like if you're coding for operative reports, you're going to start picking up speed because you'll figure out what type of procedures these providers are most likely doing, what sections you need to look at. So start tabbing your books going, okay, I know I'm working for a GI doctor. I need to tab these certain things in GI, make notes, make little reference sheets for yourself. The other thing you can do is there are specialty trainings. So if you go to the AAPC website, so say you're working in GI, you can do like a GI specialty training. You can do specialty education sessions to help you get that speed up. And as you get more familiar with that, you'll pick up some of the speed, and just kind of keep track too. Sometimes it's helpful to do studies to see like what your kind of day looks like. You know, if you're having certain cases that you're looking at and you're having trouble piecing them together in a reasonable fashion time wise, you could set those aside and have that conversation with your manager like, hey, these are the ones I'm kind of struggling with, they're taking me a lot of time. And that might be something that you guys can do to go over during like your one-on-ones with your manager. Give me one more second here. Tiffany's asking, any suggestions for getting clients for my medical billing purposes? You've done LinkedIn, you've done Facebook. As far as getting clients can be tough. I've not had personal experience with having to get clients on that end. You want to go where you think your clients are going. So maybe if there is a local medical society, you could try there. Maybe if you're in, Kansas, you could try the Kansas medical societies and see if maybe there's someone there. You could, that is tough for medical billing clients. I have general social media recommendations I can give. I know, Facebook and LinkedIn, there's a difference between kind of ads and providing helpful content. So maybe you have a specific, tips that you can give. So maybe providers, one of the things that they have is, one of the tips that you can do is, what the heck is going on? I swear to God, if this is my ex-husband, I'm going to be so mad. If there's specific tips, things that providers ask you a lot, that they're like, hey, I need some help with my billing. Here's my top 3 questions. Make some content specific towards that. Like, here are the top 3 things that providers usually ask me about their billing. And you can give them some sort of value, like a quick hit. Then they're going to trust you more. They're going to go, oh yeah, these are the things I usually miss with my billing. And this girl, she knows what she's doing because she clearly already has some answers to some of my top questions. So in those cases, you can target some more with that because they'll see that you kind of got that value in there. Dude, you guys have no idea what my ex-husband's been up to lately. Like, that's why I had to flee to Disney the other week, because it's just but yeah, it's funny because you know what? I have not seen this level of spam that I get sometimes in like way more popular channels. So it's kind of funny. I don't know what the heck, how this guy has like 16 different accounts too that he keeps popping up on me, all called Harvey Price. And he's blocked, and I don't know what the heck all of this is. So that's frustrating. That is super frustrating. The heck? I don't know. Anyway, yeah. Thank you guys. I really appreciate your support. That is a weird thing. I don't know. Jamie King, yeah, I enjoy ICD-10 is probably my favorite. And you know what I love the most about ICD-10-CM is, unlike CPT, it's a free resource. So in order to teach ICD-10-CM, you have free resources that you can use. You can say, hey, go to the CDC website, go on CMS, and you can download basically the ICD-10-CM book. If you, however, want to teach CPT, there's really no free resources for CPT. There's a couple of kind of look-up-y tools that you can utilize, but not in the way that you can for ICD-10-CM. And ICD-10-CM, I think, is just organized a little bit better as well. So let's see. Yeah, so I actually don't do I can talk about, I do have a video on NCCI edits that you can check out on the main channel page in order to talk about CPTs and how CPTs might be bundled together. As far as the APG, EAPG consolidations, that I'm not super familiar with. I can talk about CPT bundling, not too much about the other components. But yeah, I do have a video on NCCIs that I just did the other week. I think it was, yeah, just Tuesday. And that's one you probably should check out. Christina's asking, after you go through all the steps for E&M to do all the 3 components, have to match up choosing a code. So first you have to know where the location of that service was rendered. So if you're looking at inpatient coding or skilled nursing facility coding, you have to kind of look at, like, where's that location? Is it in the skilled nursing facility section? So then you go to the skilled nursing facility section and look at that. So for example, I can show you kind of here in the document camera how we go through. So like here for emergency department, if we look at the emergency department codes, so this one here is emergency department visit, expanded problem-focused history, expanded problem-focused exam, and medical decision-making of moderate complexity. So once you figure that out, if you've met or exceeded 3 of these key components, then this would be the code that you use. If you did more than this, you can check the level 4 and you can go, okay, did I do at least a detailed history, at least a detailed an exam, and at least moderate complexity? So that's how you piece it together through that. You figure out the location, and then do you need 2 of the 3 key components, or do you need 3 of the 3 key components? So that would be what I would suggest. So this one would be emergency department. If you're not in the emergency department, if you're doing inpatient coding, if you're doing skilled nursing facility, if you're doing a consultation, so here for like inpatient consultations, you need 3 of the 3 components. So in order to code for a 99252, we would need at least an expanded problem focused and an expanded problem focused exam and a straightforward medical decision making. Okay. And then some of the E&M services aren't based off of key components. So like critical care is based off of time. But then you can see like nursing facility services, they are based off of the key components. So this one here is only 2 of the 3 key components. So detailed, and moderate would need to be hit 2 of the 3 for a 99309. Corey, the question that you're asking off the top of my head, I do not know. Yeah. Gemma's asking, why is the endocrine section with the female reproductive system in the CPT book and not a separate section? Probably because they just didn't have anywhere else to stick it, so they just put it at the end of there. I don't have an exact reason why the AMA did that. But yeah, so thank you, everyone. We're actually at the end of our time. So thank you so much for hanging out with me today. I will see you guys next week. And until then, just keep on coding on.